I'm Judi Clarisse Paderes, a second-year medical student, and this video is all about physical examination. Hope you like it! Physical examination is the process of evaluating objective anatomic findings through the use of inspection, palpation, percussion, and auscultation. So these findings should be integrated into the patient's history and pathophysiology. So what are the equipments or materials that we need for our physical examination? So we have our stethoscope, our sphygmomanometer, our pen light, and our neurohammer. And in order to protect ourselves and the patient, we need to use the mask, the exam gloves, and 70% alcohol. So reminder, before we start with our physical examination, we should remember to do proper hand washing. Magandang hapon po sir, ako po si Judi Clarisse Paderes, second year medical student. And may I know your name po?
Adrian po.
Okay sir, so ngayong araw mag-physical exam ko po namin para po malaman natin ang overall health condition nyo.
Sige po.
This will take around 20 minutes, okay lang po ba?
Okay naman.
I will now observe the patient's general appearance and assess his level of consciousness, coherence, and orientation. Sir, kumusta po pakiramdam nyo ngayon?
Sige lang po.
Okay lang po. Alam niyo po ba kung nasaan kayo ngayon?
Sa clinic po.
Okay, clinic. May kasama po ba kayong pumunta dito?
Wala po.
Okay, sir. The patient is awake, conscious, and coherent, and he is oriented to time, place, and person. No cardiopulmonary distress was noted. Okay, sir. Let's start by taking your vital signs, and let's start by taking your blood pressure. Okay, sir, angat ko lang po yung sleeve nyo. So, relax lang po. Okay, sir, start na po natin. Okay, sir, normal naman po yung BP nyo, 100/70. Okay, check po natin next yung pulso nyo, sir, tapos yung paghinga nyo. Okay, parang naman kami. Okay, starting. Okay, sir. Thank you po. So, okay naman din po yung pulse nyo, pati yung paghinga nyo. Yung pulse rate nyo po is 81, which is normal. And yung paghinga nyo po is 18. Normal din. Next, check po natin yung temperature nyo. Okay, sir, ilalagay ko po sa armpits nyo. Pakikit na lang po. Okay, susunod po. Sir, while taking your temperature, check ko po yung pulse nyo po sa both arms. Okay, okay naman po. Check ko na din po yung skin nyo, sir. Taas ko lang po yung sleeve. Wala naman scars. Mukha naman pong dehydrated. Taas ko, sir. Okay po. Okay. Check ko na din po yung hands nyo. Check ko na din po yung capillary film. Okay po. Kunin ko lang po yung thermometer.
Mahulog.
Ay. Okay, sir, yung temperature niyo po is 35.5. Within normal range naman po siya. So our patient's vital signs are all within normal range. So the normal range for blood pressure is less than 120 for the systole and less than 80 for the diastole. For our pulse rate, the normal range is 60 to 100 beats per minute. For the respiratory rate, the normal range is 16 to 20 cycles per minute. And for the temperature, the normal range is 36.5 to 37.5 degrees. Okay, next sir, check ko lang po yung hair at yung scalp nyo. Check ko lang po. Pakibend po na onti yung head. Thank you po. Okay naman po. Sir, sabihin nyo po kung may masakit kayo mararamdaman. Okay pa po, sir?
Okay naman po.
Okay. Okay po, sir. Tanggalin na po natin yung mask. Check ko po yung nerve sa face nyo. Okay, sir. So, pakinggan nyo na lang po yung sasabihin ko sa inyo. Pakisundan na lang po. Okay, so pakiangat po yung eyebrows. Pakikunot po yung noo. Paki-close po yung eyes. Okay, open na po. Pakilobo po ang yung mga pisngi. Okay. So, check na po natin yung eyes nyo, sir. Hawakan ko po yung mukha nyo.
Sige, okay lang po.
Tingin po sa taas. Tingin po sa baba. Okay po. Check po natin yung pupils nyo. Tingin po ng diretso. Okay. Pakisundan na lang po tong pen light with your eyes, sir. Okay po. Check po natin yung ears nyo ngayon. Okay naman po. Next po yung mouth nyo, sir. Medyo dry po yung mouth natin, sir. Paki-open po yung mouth. Pakilabas po yung dila. Okay, pakitaas po. Down. Move po side to side. Okay po, paki-open wider and labas pa po yung dila and say out. Okay po, sir. Thank you. His hair is evenly distributed with no signs of infestations, no noted lesions or scars, and there is also no tenderness on his scalp. He has normal facial symmetry, and his ears are aligned and symmetrical with no noted lesions or discharges. His puncta is not obstructed, nor does it excretes any discharges. He has pink palpebral conjunctiva and anicteric sclera. His pupils are equal and reactive to light and accommodation, and his extraocular muscles are intact. For his tongue, his hypoglossal nerve is intact. For his oral cavity, he has moist buccal mucosa, no tonsillopharyngeal wall congestion, no exudates, and his uvula is at midline which rises upon phonation. We will now inspect the patient's trachea, lymph nodes, and thyroid gland on the neck. So, okay na po yung sa head natin. Next po natin i-check is yung neck. So, pwede nyo na pong ibalik yung mask nyo.
Sige po.
Okay, sir. Tingin na lang po sa taas. Check ko lang po yung trachea nyo. Okay, sir. Okay na po. Tingin po. Punta naman po sa likod nyo. Kakapain ko lang po kung may makulani kayo.
Sige po.
Tingin po ang diretso. Okay po, sir. Next, check po natin yung thyroid gland nyo. Okay, sir. Pakibaba po yung head. Okay, sir. Lunok po. Okay po. So, okay na po. So, there is no noted cervical lymphadenopathy. Trachea is at midline and thyroid gland is not enlarged and not tender and rises upon deglutition. We will now examine the back, particularly the spinous process and the lungs. Ngayon, sir, check na po natin yung likod nyo. So, pwede ko pa bang iangat yung damit nyo? Okay, sir, slightly bend forward po tayo. Sabihin niyo lang po sa akin kung may masakit na part pag pipindutin. Okay pa po, sir?
Okay lang.
Okay po, next, check ko na po yung lungs natin. Okay. Papakinggan ko na po yung lungs niyo, sir. So, inhale po through your nose and exhale through your mouth. Okay, sir? Okay, sir, inhale. Exhale. 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 Okay, sir. Inhale po. Exhale. Inhale po. Exhale. Inhale po. Exhale. Okay, sir. Last na po. Inhale. Exhale. Okay po. Mukhang okay naman po yung lung sounds niya. Next po, check po natin yung kidney. Pakisabi na lang po kung may masakit.
Sige po.
Okay pa po, sir? Okay pa, sir? Okay, sir. Baba ko na po yung damit nyo. Spine is at midline. There are no noted scars, lesions, or tenderness on the spinous process. For the lungs, it is resonant on all lung fields. Bronchovesicular sounds are present, and there are no crackles or wheezes. Okay, sir, proceed na po tayo sa pag-examine sa inyong chest at abdomen. So, higa na lang po kayo dito sa exam table. We will now measure the jugular venous pressure. We'll listen for carotid bruits, and we will now auscultate the heart. Okay, sir. So, check lang po natin yung pulso nyo po dito. Face na lang po sa left. Sir, measure ko lang po. Sorry, sir. Okay, 4 centimeters plus 5. Okay, sir. Check ko naman, pakinggan ko naman po yung pulso. Sige, sir. Tingin lang po sa left. Okay. Okay naman po yung sound. So, sir, angat ko na po yung damit nyo. Check ko lang po yung anterior chest nyo. Okay lang po?
Sige po.
Napin ko lang po yung PMI nyo, sir. Pakinggan ko na po yung buong heart nyo. Okay po. Good heart sounds. Ngayon, okay na po yung sa chest. The jugular venous pressure measured 9 centimeters. There were no carotid bruits that were noted. The point of maximal impulse was located at the 5th intercostal space mid-clavicular line, and no heaves or thrills were noted. Also, there were normal rate and regular rhythm of the heart sounds, and no murmurs were heard. We will now examine the abdomen. Yung abdomen na po check ko. Okay. Pakinggan ko lang po ulit.
Sige po.
Okay, sir. With vowel sounds. Forecast po natin. Okay. Sir, pre-press ko po lightly. Sabihin nyo lang po kung masakit.
Sige po.
Okay, sir. Ngayon, deeply naman po. Sabihin nyo lang po kung may masakit. Okay po. Okay, sir. Check na po natin yung liver nyo. Okay lang po, sir.
Opo.
Okay, next yung spleen nyo po. Okay lang po.
Opo.
Okay, sir. Abdomen has no scars, no lesions. It is flat and non-distended. It has normal active bowel sounds and it is tympanitic. There was no noted tenderness upon light and deep palpation. Also, there is no hepatomegaly or splenomegaly. We'll now inspect the patient's lower extremities. Okay, sir. Inspect ko na po yung legs nyo. So, itaas ko lang po konti itong pants nyo. Okay lang po?
Opo.
Okay. Sir, yung sugat nyo ngayon lang to?
Opo.
Hindi naman po dahil sa sakit or what?
Hindi naman po.
Okay po. Check ko lang po kung may manas. Okay, wala. Check ko lang po yung pulse mo dito. Yan yung pulse nyo din po dito. Okay po. Sige sir, urong po kayo dito sa end of the bed. Sige pa po sir, check na po natin yung knees niyo. Okay. Okay sir, angat ko pa po to. Check ko na po yung reflex nyo.
Sige po.
Okay. Okay po. Check po natin yung reflex niya dito sa arms. Okay po. Dila po. Okay. Okay na po, sir. So, tayo na po tayo. Wound scars are noted. There is no edema. And there is full range of motion on all his joints. There are also equal pulses on the dorsalis pedia and the posterior tibialis pulses. We'll now check the bicep and patellar reflexes, also the gait of the patient. So, maglakad po kayo dito hanggang doon po. Check po natin yung paglakad niyo. Okay. Okay, sir. Stop na po. Balik po sa akin. Okay po, sir. So, balik na po tayo sa exam table. Explain ko na po yung findings ko. So, the patient has normal reflexive bicep and patellar reflexes. Also, he has normal gait. So that ends our physical examination, and I would like to thank Dr. Bacani and Dr. Dominguez for giving us this opportunity to learn these skills. I hope you enjoyed watching, and thank you.